This has been a Jet 24 Fox 66 special report. For ongoing developments, log on to yourerie.com. We now return you to your...
Good afternoon. We interrupt our regular programming this afternoon to bring you a special report, an update on the spread of COVID-19. This week already seeing one-day spikes in cases and deaths in Erie County. We go live to the studios of WQLN TV. Here now, Erie County Executive Kathy Dahlkemper.
Thank you for joining me today as I give you an update on COVID-19 here in Erie County. We have 12 new cases of COVID-19 to report today and 1 new death. That brings us to a total of 1,037 cumulative positive cases since March here in Erie County. 183 of those cases are currently active. 828 have recovered, and a total of 26 deaths have now occurred. To date, we have 18,187 negative tests. Of the cumulative cases in Erie County, 58% are female and 42% are male. The breakdown by age goes 3% 0 to 4, 2% ages 5 to 9, 6% ages 10 to 18, 15% ages 19 to 24, 38% ages 25 to 49, 19% 50 to 64 years, and 16% are ages 65 and older. And again, please note that sometimes our percentages don't come up to 100 due to rounding. Regarding the race and ethnicity of our cumulative cases, 50% are white residents, 25% are African American or black residents, 7% Asian, and 3% others, with 9% being unknown. Regarding Hispanic origin, 9% are Hispanic of any race, and 80% are non-Hispanic, with 12% being unknown. So please continue to physically distance yourself from others that you do not live with. Practice good hygiene, washing your hands for at least 20 seconds and using hand sanitizer when you cannot wash your hands. Please stay away from anyone who's showing any symptoms of illness, and always continue to wear your mask, even when outside, when you go near people who do not live with you in your own home. And now I would like to invite Melissa Lyon, the Director of the Erie County Department of Health, to give you an update from the Health Department. Melissa?
Thank you, County Executive. It was recently brought to my attention that there are several misconceptions about the role of the Erie County Department of Health managing of the COVID-19 pandemic. It seems that the Erie County Department of Health is being held responsible for data collection and release of data that are not actually under our jurisdiction or authority of public health. It's important to point out what public health is and what Erie County Department of Health is responsible for. So I'm going to take a few minutes to explain the difference between public health, which is the responsibility of the Erie County Department of Health, and healthcare, which is not under the Department of Health's responsibility. There is a clear difference, and hopefully this will improve the understanding in the community. Public health is designed to prevent injury, illness, disease, and premature death by using population and policy-based strategies. One example of a public health initiative policy is the Clean Indoor Air Act. It prevents exposure to secondhand smoke, which in turn prevents cancer. Another example is food safety. The food safety law sets safe food handling practices in an effort to prevent foodborne illness. Restaurant inspections identify and cease unsafe food handling practices at facilities through education and enforcement. During this pandemic, one of our roles is to manage isolation and quarantine of COVID-19 infected persons or exposed persons to prevent the spread of the virus to other people in the public. So these are a few examples of the population-based activities that Erie County Department of Health does to keep communities safe and healthy. The Erie County Department of Health does not typically treat patients, monitor treatment, or even the care of patients. That's where healthcare facilities are responsible. Healthcare, like hospitals, urgent care facilities, physicians' offices, are primarily designed to treat sick people, and their goal is to assist in the recovery of that individual. The reason I point out these differences is that the Department of Health does not receive or maintain information about hospitalizations or the types of treatments that individuals are receiving with the hospital system. This also includes the use of ventilators. This is not data that the Erie County Department of Health tracks or reports on. It's information that is entirely the responsibility of the healthcare systems and individual hospitals. It is reported directly to the State Department of Health and not to county health departments. Unlike other states in the U.S., Pennsylvania has a decentralized public health system. There are only 10 of the 67 counties in Pennsylvania that either have a county health department or a city health department, and therefore the Pennsylvania Department of Health collects all of the health data for the state. We at the Erie County Department of Health are not in a position to collect data separately from the state system. We must rely on the data that they collect and report. The statewide systems are designed to standardize data collection and reporting. This prevents disruptions or inconsistencies in data collection and management systems. The Erie County Department of Health does not have an all-access pass to data collected by the state. The Erie County Department of Health only has access to the data that is needed to prevent the spread of disease. So in regards to the pandemic, we received data regarding laboratory-confirmed cases of COVID-19 only, and very little additional beyond that. We use that information to do contact tracing. We contact the COVID-19 positive individuals, obtain their contacts, and then require the appropriate isolation or quarantine to prevent the spread of disease throughout the community. When disease investigators require isolation or quarantine, it's done to protect the population that does not have illness. It's all about prevention. If the individual is very ill and requires treatment, that occurs within the healthcare system through primary care providers, hospitals, urgent care centers, and so on. Public health is not responsible for providing treatment, nor are they responsible for data associated with such care. As the Public Health Director of Erie County, I want to assure all of the listeners today that we are reporting accurate data as it relates to public health disease prevention. The data we use is to prevent the spread of disease within a community. That's our primary job during this pandemic. We need your help by responding to disease investigator calls and questions if you test positive for COVID-19 or have been identified as a close contact to someone who has COVID-19. As a reminder, a close contact is defined as someone who has been within 6 feet of someone for 15 minutes or longer. With your continued communication, cooperation, and compliance, we will get through this pandemic. I hope this was helpful. Thank you, County Executive.
Thank you, Director Lyon, and always a great message for our community, and I appreciate that kind of explanation there. I'm also happy today to welcome Dr. James Lynn with us. Speaking of our healthcare partners, he is the president of LECOM's Institute for Successful Aging, and he will have a few words to say and then be here for questions. Dr. Lynn?
Thank you, County Executive. So thank you for having me. I figured this would be a good opportunity for me to update the community on our Northwestern Pennsylvania Regional Response Health Collaborative. This is a brand new program that was passed by legislatures to appropriate the CARES Act money for us to support our long-term care facilities for COVID-19 support. LECOM Health was fortunate enough to apply for the grant and be granted the award for the grant. And we're put in the lead position to help all the facilities here in Erie County that's defined by long-term care. And long-term care is defined by skilled nursing facilities, as well as personal care and assisted living facilities. So our primary focus and job is to support the facilities in helping them accomplishing the universal testing for both employees and residents in their facility. In addition, our job is to help support education and resources to help the facility get through and make sure that they have the appropriate policies and procedures in place to deal with the COVID-19 pandemic. And finally, our job is to help support outbreaks. So if there is a spike in a facility in terms of residents or employees testing positive, with collaboration and interagency cooperation at the state level with DHS and DOH and our local partners, our job is to go in to contain, to assess the risks, and stop the spread of the virus within the facility and help support both the employees, the caregivers, as well as the residents that are living in the facility. We also have a vast amount of resources in terms of educational materials that we partner with Jewish Healthcare Foundation down in Pittsburgh, that we will be supplying educational materials to caregivers, facilities, and patients' family in regards to infection control policies, as well as other information regarding the COVID-19. So I'm happy to answer any questions, and we're really happy to be here, and we're eager and willing to support our community in the long-term care facilities. So thank you for having me.
Thank you, Dr. Lin, and it's great that LECOM is really such an important player in terms of helping the stop of the spread of COVID-19, particularly within our long-term care facilities. And we want to thank them for all the important work that they are doing. I want to let the media know that Dr. Lin can only be with us until 3:30 today. So if you do have questions directed to Dr. Lin, you might want to make those in your first or second round of questions. I think we have a couple other media outlets with us today, but I'm going to now turn to Erie News Now for the first questions today. Erie News Now?
Good afternoon. A question for Dr. Lin regarding long-term care facilities. What would be the process, and what is going on at a facility like Twinbrook that is seeing a pretty sizable number of patients and staff members infected with the virus?
Sure. So, as I mentioned before, all the long-term care facility has to complete their universal testing for both employees and residents. And I believe the facility is in the process of doing all that. Then they are, after you do the universal testing, they have to constantly screen and retest their employees and residents. In this particular case, in the last week, they were doing their testing, and it did come up that their employees had, a few of their employees came up positive, and then a few of their patients came up positive. As soon as this happens, and most of the long-term care facilities, and in this particular case, they were on top of it right away. They obviously recognized that there was a spike in the positive cases within their facilities. They notified the appropriate agency, and then the motion is set in place to sort of deal with this. So we, as a RACP for Northwestern Pennsylvania, did reach out to them to see if they need any assistance, and we actually did our assessment forms with their corporate headquarters, as well as we're in contact with their local administrators. And the situation is that as of today, or the latest that I've known, they have 25 positive patients in their facility, and they have 17 staff members that tested positive. All of whom are quarantined, and they are doing all the appropriate things in terms of cohorting their patients, so that they're moving away the positive patients away from negative patients, following the Department of Health guidelines with the red, yellow, and green cohorting mechanism. And we're here to help them support with any staffing needs or PPE needs, and we're in constant contact with their administration so that we can provide the support the way we're supposed to. And my understanding is that they have their situation in control, and that we're being in contact on a daily basis to assess the situation as things change.
Doctor, could I get you to go a little more into detail there, and as easily to understand as possible? Take me through the process of what happens with those infected patients, and also with patients who haven't been infected. You know, if I'm a family member of someone who's in Twinbrook, what's going on in there? What's happening with my loved one if that loved one is has contracted the virus or has not and is trying to avoid it?
So in any facility, not just that particular facility, in any facility, when we have a positive patient that we tested, obviously we follow, the first thing that we do is to look at the facility map to see what opportunities we have to separate the positive patients away from the negative patients. And in addition of doing that, I mentioned the recommendation of the Department of Health in terms of cohorting, in terms of the red zone, which is the positive patients, and then a yellow zone, which is persons that were exposed to the positive people, or that we're suspecting or waiting for tests to come back, that are high risk for being positive. Those people will be placed in a yellow zone. And when those areas are set up, all staff members going into those zones are in full PPE gear with N95 masks, face shield, gowns, and the whole works until we have confirmed results, whether they're positive or negative, and then we move them into appropriate areas. Now, the green zone should be away from the yellow and the red zone if at all possible. If the physical facility cannot separate into those red, yellow, and green zone, then we have to make accommodations to make sure that we move the patient or transfer the patient to appropriate places that can place the positive patients away from the negative patients. And it's a little bit more complex, and we can be here for a while, but in general, those are the steps that we take to really move the patients. And the situation can be fluid because right now, when we get the test out, some of the testing labs partners that we have are taking time to bring the results back. So as we're waiting for these results, your loved one may be placed in the yellow zone, and then when he comes back 2 or 3 days later, they may need to be moved again because they become positive. They need to be moved into the red zone. So there is a lot of moving, and I know that a lot of these patients have been living there for a long time, and it's very disruptive to move them. But that's what it takes to really protect these patients within the facility to stop the outbreak.
Thank you so much, Dr. Lin. I'd now like to turn over to Talk Erie. Joel?
Yes, here's a question for Dr. Lin as well. Dr. Lin, at one point the state health director was saying that she would like to test every week or every other week the patients and the workers at long-term care facilities. That got walked back. Now the goal was to test them once, and they did that by the end of July. What kind of regularity do you anticipate in your footprint with your cohort for testing of those facilities?
Yeah, ideally, in an ideal world, the more tests that we do, the more information we have, and the more ability we have to deal with this situation. But the reality of it is that there is still a shortage in supplies and testing. And there's also a whole host of logistical issues once you test the individual, the aftermath, because of course there's false negatives and false positives because no test is 100%. So in this scenario where we're in right now, we do the best we can to assess the risk at the time of the situation. And based upon that assessment and the risk, we sort of risk stratify to see who needs to be tested and the frequency needs to be tested. Of course, there is a guideline that we follow. So like, for example, if there's a facility that have completed the universal testing and then 14 days later they have one positive case, then in that situation, we would have to retest everybody 100% in that facility again, and then wait out the 14 days and then retest everybody to make sure that it's negative. The people that are negative stays negative. So there is a frequency that we follow. And as far as sort of universally testing everybody, on a weekly basis, I would tell you that that's a good goal to work towards. But until we have enough supplies and also the testing becomes more validated, because right now any test that we do for COVID, just so everybody knows, is still all under the Emergency Authorization Act from the FDA. So it's not 100%, although it's very good. And it's one of the tools we have to help us deal with this pandemic. But it's just we have to use it judiciously because there's a lot of complicated implication afterwards if we have a false positive or false negative.
Just as a quick follow-up, Dr. Lin, can you assure our listeners here that the testing supplies that are in the Northwest Pennsylvania footprint will stay in the Northwestern Pennsylvania footprint and not be confiscated to go down to the Southeast, like has happened with some of the PPE and other supplies earlier in the pandemic?
Well, I don't think I can assure. I have no control over how the supplies of those PPE per se. But I can tell you that LECOM Health is doing everything possible to have enough stock in PPE to help our fellow long-term care facilities, because that's the charge of our regional response healthcare collaborative. But I can't speak for the state in terms of how they utilize their resources.
Thank you, Dr. Lynn. We'll now go to Erie Times News.
Hi, Kathy. It's David. This question is also for Dr. Lynn. Hey, Dr. Lynn, did the collaborative, my first question is, did any patients at Twin Brook need to be transferred to other facilities, or were they able to just move them around within their own facility?
Yeah, as of today, David, my understanding is that they're able to accommodate all those patients within their own facility.
Okay. And then has the collaborative been involved with any of the increased cases at the other long-term care facilities?
Yes, we have gone out to support a few other facilities, and again, one of the facilities that had positive cases, they are on top of it, and they have all the situation under control, where they have do the appropriate cohorting, and they have done appropriate movement of the patient to keep their staff and patients safe. So yes.
And were those? Can you name those facilities? Was it Cory, Manor, and Pleasant Ridge?
So I can tell you that we responded. We were out at Cory Manor, and we did our assessment, and they're doing a good job in containing what they need to do in terms of keeping their patients safe. Yes.
Thank you, Dr. Lynn. Jet TV.
Yes, hi, Kathy. It's Samir. I'll stick with Dr. Lynn for right now. So, Dr. Lynn, yesterday I spoke with two nurses at the Twin Brook facility, and basically they were claiming that there's no guidance from the state really to kind of not cross-contaminate, especially with these positive cases. So I guess, can you shed some light? Because the two nurses I spoke with, you can check the story out on YourErie.com, saying that they are really concerned and believe that's adding to the spread within the facility. So I guess, are you satisfied with how the state's handling, I guess, information down to these nurses at these facilities, nursing homes specifically?
Yeah, so to answer your question, we do not, I just want to clarify for the audience and listener that the Regional Response Health Collaborative have no authority over any regulatory things. We're a collaborative where we have the resources to be invited into the facility to provide any support that they would need. And certainly any information that we pass on to a particular facility has to go through their organizational structure. So we start from their administrators down to their leadership, and it's up to the leadership team to actually pass it down to their frontline staff. So I don't know who you were speaking with, and maybe it was a frontline staff, and certainly I would hope all the information that we're giving them are getting passed down to them. And if they need any educational support, we're here to help them. So just to give an example, we'll be going out there to help them with N95 mask test fitting because there's a scarce resource in sort of the kits. And LECOM was able to secure some N95 test fitting kits. So we're going to be providing resources to go down there, and we're coordinating with their team to help them fit everybody to make sure that the N95 mask is fitting and all the PPE gear is appropriate. So that's one of the examples that the collaborative helps. We're not in the position, or our job is not to go in and police how they run their facilities or how they educate their staff. Our job is to make sure that they have the appropriate tools and they have appropriate resources that they need to do their job, and it's up to the individual facility to carry out their own mission and their own operations.
Thank you, Samir. We also have with us today Sandy Rhodes from West County News Journal. Sandy, are you with us?
Yes, I am. Thank you. I am more concerned, well, not more concerned, but there's been several days with double-digit increases. And at what point would the county or the state sort of send us back to the yellow or the red phase, and who makes that decision?
Well, those decisions are made on the state level, and I'm going to turn this over to Director Lyons to speak to these to the numbers specifically. Director Lyons.
Thank you, County Executive. Executive. So we have experienced double-digit numbers for multiple days in a row, and some of those would have appeared shockingly high, such as our highest number of 42 cases. And as we know, this virus is very contagious, especially when we are as a community gathering and socializing and not following appropriate masking and or social distancing practices. However, it's been a matter of time and sort of watching those numbers, knowing that this could occur for us, especially as we see some of our neighboring communities, such as Allegheny County. As County Executive has said, the state would make any determinations of large sweeping rollbacks to a yellow phase or shutdowns or lockdowns of certain businesses if we were seeing trends or outbreaks associated with specific activities. So for example, in Allegheny County, they were tracing some of their high numbers to socializing at crowded bar situations, and so they took action there. The local health authority does have the ability to make recommendations or based on the data that we're seeing, if we were to change any of our practices, if that were to be large sweeping closures of certain activities, we would coordinate very closely with the state before any changes were made to our activities. We would ask for their endorsement by demonstrating that the data supports that decision making. At this time, there's not been any metrics that have been rolled out to the local county municipal health departments that if you hit a certain threshold of numbers over a certain number of days or incident rates per 100,000, that you would have to go back to a particular point in time, say yellow phase. So I would like to answer this question. Obviously, this is a longer response than maybe you had anticipated, but it's very fluid, and we communicate and coordinate with the state regularly. And so far, we're managing these numbers with the contact tracing and the disease investigation that we have in place. I can assure you there's been some tough days and some long days, and we're grueling days. However, right now, we're managing it. So thank you for the question.
Thank you. Are there any other news outlets with us today?
Yes, Kathy. This is Jordan Trekkingoff from the Cory Journal. I have a question for Dr. Lynn.
Go ahead.
Dr. Lynn, the state reported yesterday that Cory Manor has 18 residents and 9 staff members who have tested positive for COVID-19. I know you previously said you assisted the facility with the current outbreak there. So can you tell me what is being done specifically at Cory Manor, and has anyone required hospitalization?
Yeah, so currently they have separated all their positive cases and suspected exposure cases away from their negative patients. The staff, the facility has enough PPE. They are all appropriately using the PPE, and they needed a little bit of support in fitting an N95 mask because those test kits, as I mentioned earlier, same as Twinbrook, that there is a shortage in those test kits. So PIMA actually is helping Cory Manor in assisting them in fitting their staff and re-educating, retraining a lot of their caregivers in terms of infection control and those type of activities. So Cory Manor has gotten a lot of support from the state as well as from a little bit from our RACP, and they are managing that very well. And they're juggling with staffing because of the number of staff that was positive. So all of them are off work. So now they have to sort of relook at their staffing. So they're working through that as well. So.
And have there been any hospitalizations that you know of at Cory Manor?
I do not know that. As far as I know, I don't think so, but I'm not sure because, again, those type of things is up to their facility physician, the attending physicians to decide. We have not been asked to help out in assessing those situations. So I do not believe so when we're out there doing the assessment earlier late last week. But I don't know if things have changed since I was there. So.
Okay. Thank you.
And I just want to see if there's any other news outlets with us today. Hearing none, we'll go back to Erie News Now.
Hi, Director Lyon. We talked last week. You spoke with one of our reporters, Dan Bartels, and said if we had a handful of days with double-digit cases, that's where things start getting a little bit dicey in terms of managing things. Obviously, still managing them now, but how much longer can we withstand days of double-digit cases before the system gets backed up?
So I'm not able to predict how long we can sustain, multiple days of high numbers of cases. Each day brings a different, as I've been referring to it, a nuance to what those cases look like. So, for example, when we had 42, 21 of them, or half of them, were related to a long-term care facility or long-term care facilities. And therefore, if you can imagine, those would be easier to quote-unquote contain, or we spend less time, per se, on letting individuals know that they have to stay in place. So it's hard to predict where we become overwhelmed, and I'm going to put forward that as of now, we're doing well, and we also have the capacity to expand out additional staffing within our system as needed. It's never a fast and quick fix, but we could do that. And the state also has offered some assistance if needed, and we also have community partners that are building in their knowledge and capacity and could help if we needed that assistance. So the good news is we're in a very different place today than we were 3 or 4 months ago with capacity. Thank you.
Oh, I'm sorry. When you say that the state has offered more help, you mean additional contact tracers?
If we would need to request those, that is correct.
So those are available if needed, but we don't need them right now?
Correct.
Okay.
Thank you. Talk Erie?
Yes, hi. This question is for Director Lyon as well. Help me navigate the data, if you will. Right now, it looks like over the last 14 days, we really had a skyrocketing in cases per 100,000 population. It's around 83. Yet our infection rate has not really grown that much, maybe less than 0.5%. Is that why you're feeling like you still have a pretty good handle on the virus, that we really don't have like this out-of-control outbreak?
And Joel, when you say infection rate, are you talking positivity of the number of cases or those per 100,000?
Yeah, positivity of number of cases. And again, it's a cumulative number. I realize that it probably is much higher in the last 14 days.
Okay. Yeah, so you have hit on watching that positivity rate is a really important portion of what we do from a public health perspective. We do a county-wide positivity rate, and then we're recently been looking at geographic areas of positivity rates. So realistically, we could have areas in the community that have a higher positivity rate that we would be concerned with, and we would put additional resources into those communities to get additional testing, education, and resources there. But as far as a county-wide right now, we're seeing cases coming from all over the county. However, there are a handful here and a handful there in general, and it's being able to, we're keeping our fingers on the pulse of it. Things are going relatively smoothly.
Just a quick follow-up. Could it be that we are able to test better now than we were in May? And so we're just kind of getting a better, more accurate picture of the virus right now?
Yes, so there are obviously more sites that are collecting specimens and submitting samples, and that's extremely helpful. We would like to have more access to testing for those that we would consider pre-symptomatic or have been identified as contacts of known positives. That would even give us a better picture of what's happening there. So we are getting more testing. It has been reported to me somewhat anecdotally that some of the sites are able to even test for individuals that want to get back to work, and the employer requires them to have a negative test. And so we are seeing some of that in our community, which is incredibly helpful. We had not seen that in the past.
Thanks for the explanation.
Thank you. Erie Times News. David?
Yes, Kathy. This is for either you or Melissa or Dr. Lynn, whoever wants to answer it. It's been kind of a long tradition where there are some nurses and nurses aides who work at more than one long-term care facility. They go between two. I think Samir got to this a little bit. Is that something that from a public health perspective, with increased cases at some of these facilities, is there a desire to have that end, to not have these employees go among more than one facility?
Dr. Lynn, are you still with us? Okay, I just got word I know he had to drop off around 3:30, so he's no longer with us. I mean, I certainly can have Director Lyons address that first, and then I can say a couple words.
So we are aware that there are employees that work at multiple facilities for a couple of reasons. That staffing is in high demand for long-term care facilities. And we also know that many of them are able to be per diem at multiple facilities. And so it is just traditionally how the staffing of those facilities operate. Also because many of them are 24-hour operations, they're shift work, and that has benefit for those employees as well as it's hard to fill those positions. So the uniqueness of the job has lended itself to employees working at multiple facilities. I'm not able to confirm that any of the outbreaks that we're experiencing now are due to an employee that might be working at two facilities at the same time. So I don't have information at that level, but we do know that that occurs. To answer, would we want that practice to stop? I think having necessary staffing at the long-term care facilities to provide appropriate care for the individuals that are there is really the priority and the most important thing to pay attention to. With that being said, there are, as Dr. Lynn mentioned, ways for staffing to be requested from other facilities or other regional partners. So I think we're in a good position now to work together collaboratively to keep everyone as safe as possible with the resources we have. Thank you.
Any follow-up to that, David?
Yes, and is there a thought, Melissa or Kathy, if you want to answer this, is there a thought that maybe we've seen, because of the testing being done, at least the baseline testing being done at all the facilities, that we may have seen the increase due to this over the last 8 days, and that maybe we're going to see lower numbers?
Well, I'm not sure if any of us could predict if we're going to see lower numbers or not, but we do know that when you do those baseline testing, you do pick up the asymptomatic people, and that's key, to know if someone is in your facility asymptomatic and is positive. You want to obviously get them back home and quarantined, and if as a resident, you want to move them into that part of your facility where the other positive patients are. So that is definitely happening, where asymptomatic cases are being picked up when you do that baseline testing, which of course would drive up your numbers. Okay, thank you. Jet TV.
Thank you.
Jet TV.
Yep, it's Samir still. So I didn't feel like my answer was answered appropriately or adequately. So to Director Lyons address that, let me break it down. Do you feel these nurses within the facilities, I guess, are trained appropriately to handle these cases once they get a positive COVID-19 case?
So from an infection control process and infection control policies and procedures, I am confident that they've all been trained on that. I'm also confident that donning and doffing training has occurred, whether it was recently or over the course of multiple years. And I reference that because from a public health perspective, even with Ebola and other infectious diseases over time, there's a required training. And so we've revisited, from my knowledge, that's been revisited pretty regularly and frequently in these facilities. So I do have confidence that they're well trained.
So then is the state kind of sending down new guidelines, or has it kind of been the same consistent through this pandemic. Of course, everything seems to be changing. So I guess what I'm getting at is these nurses felt like they weren't trained appropriately or to a sufficient amount to handle the cases, specifically at Twin Brook.
So, Samir, your question got a little bit garbled, and so I think the question was around state health department communication to the facilities and if they're appropriately trained on handling and are being communicated with. And so because the local Department of Health, Erie County Department of Health, doesn't have an authoritative role with those local long-term care facilities, it's difficult for me to answer specifically how that staff feels about their training or how that administration feels about that training. But the communication we've had with those facilities, they've not been reporting that there's been bad communication or inappropriate training. That's the best I can give you on that.
Thank you, Samir. West County News Journal, Sandy?
I'm still here, thanks. I wanted to switch gears and do more of the economic impact this pandemic has had. And I know out here in West County we've lost some businesses, specifically restaurants, with the 25% capacity, but we did have one open. But in the meantime, businesses are going to close, employees are going to lose their jobs. What does the county have in mind, and what is it prepared to do to help these businesses and employees when this happens?
Well, thank you for that question. It's a really important question. So the CARES Act funding, it's through a block grant that was brought to the county. It's a little more than $24.3 million. The ordinance was passed last night by County Council, so we are as quickly as we can putting together the application. There will be an opportunity for businesses to apply for a grant. This is not a loan, it's a grant, and the same with nonprofits as well as our municipalities. And so they will be able to apply for this money, and we will have that all up on our website, hopefully within a week or two at the most, and then we will be able to get those applications in and turn those around fairly quickly and get that money out to those very much businesses who very much need that. So the goal here is to try to help as many businesses and as many nonprofits as we can survive this virus and this pandemic. It's going to be very, very difficult as we move into the fall and the winter, and businesses can no longer, for example, a restaurant, have outside seating. It's going to get much more difficult, and we understand this, and we hope that both the federal and the state government are looking at other ways to support our businesses, as they did, for example, with the PPP program. So this is really a national issue, but we are doing what we can locally to assist those businesses. And one other piece, just so a business knows that through funding we're going to be able to give through the SBDC at Gannon, the Small Business Development group, that they're going to try to help businesses go online if they have that ability. So if it's a retail business and they're not online right now, there's going to be assistance through the SBDC where they can potentially get their products online and sell them that way. So a multitude of ways that we're trying to help our businesses survive this. How about Cory Journal? Are you still with? Are you still with us, Cory Journal?
Yes, Kathy, I'm here. This question is for you. There was a rising number of cases in the Cory Manor well over a week ago, but case counts weren't released by the state just until yesterday. Don't you think the public should be informed sooner when there is an outbreak in a nursing home, especially when it involves staff members who live in that community?
So the numbers, come through for the actual facilities through the state. Again, to Director Lyons' point, there's only so much data that we have knowledge of and information of, but those numbers, and I don't even know when those numbers came in. They probably were coming in, but they probably didn't all come in on one day. And it depends on the testing. Unfortunately, testing is not adequate across this country. It's not adequate across the state, and it's certainly not adequate across this county. And that's a national travesty, in my opinion. But the testing is often taking even up to 7 to 10 days for some people, 4 to 5 days. This is just way too long, and this has to do with the labs and the ability to have all the materials to do the testing, and then of course the labs. So these are things that are unfortunately out of our local control, but I'm hoping that the federal government continues to work on this issue and fixes that. So that is a lot of the problem here, is that we have testing that takes way too long, as well as again, those numbers coming in, they don't all come in on the same day, I guess. Now, it's important to understand, and I want to say this about all of our long-term care facilities, the virus is coming in from the outside. It's coming from the workers who are around other people who may or may not be following guidelines. I'm not saying the workers aren't following the guidelines, but maybe the people they live with or maybe the people they interact with haven't been. And so the more that people don't wear masks and the more that people don't socially distance, the more a healthcare worker may become a positive carrier. It came to our attention, having a conversation with Twinbrook, that it was an asymptomatic worker who had been tested and had tested negative, and then now is asymptomatic, and that's how it started spreading. And these are the problems with people not following the guidelines, and I mean all of us, because it is up to all of us. It's all of our responsibility to really mitigate the spread of this virus, particularly to the most vulnerable, our seniors who are living in long-term care facilities. And I really cannot emphasize that enough, that we all have a responsibility in this.
Thank you.
Sure. Erie Times News? I'm sorry. Erie News Now is next. I apologize. Erie News Now. Stay with my list here.
Thanks. Just one quick one here. What work are you doing with hospitals here as we see this recent spike a little bit in our cases? Has the county changed anything in terms of its work and its partnership with local hospitals just to make sure that they're adequately prepared and ready to go for whatever we may see?
Ethan, you're a little bit garbled, but your question, so I'm thinking that you asked, are we doing anything different in terms of working with our hospitals? Is that correct?
Yeah. Just, as we see this spike, any different changes there just to make sure that they're ready to go?
I'll turn that over to Director Lyon.
Thank you. I have informal, periodic, they're not set daily or weekly or monthly calls, just as the administration at either of the hospitals need to have a phone call. We will just link up time to time. And overall, when I've had those conversations, they're reporting that they have capacity, and they are reporting that they have the ability to handle additional cases if that was needed.
Do you feel confident that our healthcare system is, all the different, private entities here, but as a whole, that they're ready to go?
We have some of the most robust healthcare systems in the country right here in Western Pennsylvania. So, I'm confident that these health systems are well prepared.
Thanks so much.
Thank you, Ethan. Joel, talk Erie?
Yeah, quick one for you, Kathy. Just any plans on how you're going to distribute the $1 million in personal protective equipment to small business, as was outlined in Matthew Rink's article this morning in the paper? Are they going to have to apply for that? Is it going to be proportional? How's that work?
Yeah, they would apply for it if they need it, and we have kits, I guess you would call them, determined by the number of employees they have. So, and I don't remember what the breakdown is. The emergency management personnel have worked that out, but we will have those kits, and they can be applied for, and that will be, again, an online process that you'll be able to find on our website, and then we will get those kits out. The distribution will, again, be up through our public safety building, and we'll get those kits out to the businesses as need be. We expect that need will only increase as we go into the fall.
Thanks.
Sure. And now we'll go to the Erie Times News.
Thanks, Kathy. You talked a little bit earlier about positivity rates, and that there may be areas with higher positivity rates, and that you direct, I don't know, I can't remember if it was you or Melissa talking about it, but directing more testing in those areas. Is there currently an area, like we've talked about the 16503 zip code, is there an area right now where you're directing more efforts because of higher positivity rates?
Director Line, you want to take that?
Thank you for that question, David. As of now, the 16503 and surrounding zip codes, as has been reported on, would be the area that additional resources are being committed, and that is in collaboration with those community centers who are very well-respected leaders in their communities, and so we're working with them and hearing what they need and then helping them navigate through that if it falls into public health expectations, and then as well their health systems have been working with those community centers as well. So a really strong collaboration is coming together there, and we're grateful for all of that.
So it's that general area that's been reported on that we've known about for a while. There's not a new pocket anywhere that has come up just in the last week or so that is drawing concern.
That is correct. There is not an additional one, though we are watching the entire county as we have data available to evaluate.
Okay, thank you.
And Samir, Jet TV.
Yep, hi. This is for both Director Line and New County Executive as well. So as we, of course, are gearing up towards the academic school year, some places are allowing in-person instruction. Of course, we had Gannon students moving back in. I guess, do you anticipate a high number of positive COVID-19 cases with these students, I guess, mingling with each other? Of course, students coming to the area for college.
Well, I'll speak to it just briefly and then let Director Line add. I think anytime that you have more people getting together, you're going to have an increased chance of the virus spreading, particularly if they aren't wearing masks and aren't keeping socially distant. I think every school is doing an excellent job in trying to mitigate that chance as much as they can. There are pros and cons to opening schools and to not opening schools, and we are here in county government to assist them and give them advice and guidance when we can, but it really is up to the school district. They're not under our jurisdiction either, and it's up to them to decide what's best for their community as a whole. And Director Lyon, do you have anything further you want to say on that?
I don't have much additional to add. Your response was pretty accurate to what I would have responded. The only piece is that when we are working with school districts that need additional guidance or interpretation of we've asked them to take a look at risk assessments. And so, for example, if they're unable to meet a particular portion of the state, the Department of Education and Department of Health combined guidance, we ask them to do a abbreviated risk assessment. So just so they understand the risk of deviating from that guidance, and then they mitigate any issues that come out of the deviation. So that's helping them really think through potential problems and how they would prepare for that. That would be the only additional piece I'd add right now.
Thank you.
And then just kind of really fast, piggybacking off of that, would you as the health count or the health department, I guess, have the executive power to pull the plug on the academic schools if they were to have a, I guess, a spike within cases within their community?
All of those decisions really are done with the Department of Education and the Department of Health. There's not a particular metrics that they've released where that would be the case of shutting down in-person learning. Again, areas we've never navigated together, and so I'm looking forward to any way that we can help school districts as we're navigating that. We've never been there before, so we'll have to go there together. And I know that's not the exact answer you were looking for, but I don't have anything clearer than that right now.
The one thing I will just add to all of that is that the communication between the schools and the Erie County Department of Health has been very good, and there's a partnership that has been built between the schools and the staff at the Department of Health, and that can only be helpful going forward if we run into that type of a situation. And Sandy at West County News Journal, do you have any last question?
I have one quick question that's sort of specific to West County. As you know, the Erie County is a vast area with both city and rural areas like in West County. And Borough went green before the county was able to. Are you concerned at all about the outside municipalities, breaking off and doing their own thing, when there's still restrictions in place?
Well, actually, they are not able to because of the state's mandate, so they're not really able to, even if they do declare that they're going to do something differently. The state really does trump that.
Okay, so even if they do it, it's a moot point.
Yes. They would still be under the jurisdiction of what the state has put in place for restrictions.
Okay.
And Cory Journal?
All right, thank you.
Sure. And Cory Journal? Any last question?
Yes. One final question. We heard from Dr. Lin about what his team is doing to assist long-term care facilities with spikes in cases, but I want to know what the Erie County government and the county health department is doing to assist these facilities.
Sure. I'm going to let Director Lyons speak to that from the Erie County Department of Health standpoint.
So we have a long-standing relationship with facilities, in particular around control or disease control within those facilities. So for example, during influenza season, we have outbreak management teams that work with those facilities, assessing patients they have, if they need additional assistance, and then when it's determined that assistance is required, that is then communicated to the authority that regulates long-term care facilities, which in this particular case is Pennsylvania Department of Health. So we have a long-term standing relationship on disease outbreak containment, and we play that same role now, and we have a very busy team of a minimum of 3 people any day, and sometimes we have to pull in additional assistance depending on the situation at those facilities. I hope that was a helpful answer.
And the only thing I will add to that is, again, communication. We're trying to communicate with any facility where there's a concern, and trying to keep those communication channels open. I think that's the best thing we can do, and be there to guide them to where the assistance might be if they so need to. Also, our emergency management personnel work in terms of personal protection equipment, and trying to help them find more if that would be, for example, a need that they might have. So lots of communication going on in county government with our partners on the outside, and that's what this community is all about, and that's why Erie County is the place it is. So thank you for that question. And with that, I'm going to just round it out with our weekly reminder about the 2020 census. The response numbers are still 70% for Erie County as a whole, with 62% now in the city of Erie. So Erie City residents went up 1%, so let's keep on doing that. This is concerning, though, that the numbers continue to kind of stay at the same level amid the pandemic. And now the recent announcement by the U.S. Census Bureau that they will end in-person or door-knocking interviews on September 30th, a month earlier than what they had said not too long ago. So this means that our census takers only have half the time to follow up with households that have not responded. And this will specifically impact areas where we are seeing that low response rate. So in the city of Erie, for example, some census tracts are only at 35% response. So if these areas are undercounted, our area will lose necessary federal funding for education, for housing, for medical programs, and additionally will lose representation to less populated areas. So please, complete the census, 844-330-2020, or go online at my2020census.gov today and share this with your family, your neighbors, your coworkers, your friends. So we need to get as many people counted as we can in Erie County. On a positive note, I'd like to end with the Teen Reading Lounge at the Erie County Public Library is hosting a teen chalk art competition next Wednesday, August 12th. Registered teens will transform the concrete around the library into vibrant colors and works of art that demonstrate the power of youth and connection to their community. It's an opportunity for our teens to tell their own story through art and to win prizes. This program is free. It's open to all teens ages 13 to 18 years of age, and for information or to register, you can email teenspace@eriecountypa.gov. That's teen, T-E-E-N, space, S-P-A-C, at eriecountypa.gov, or call the Teen Space at 451-6904, 451-6904. So with that, I'm going to conclude today by asking you all to please remember to keep your distance from those you do not live with, at least 6 feet, to always wash your hands as frequently for 20 seconds, or use hand sanitizer when you cannot wash them, and to wear your mask when you're away from your home and around other people who do not live with you. If we all do all of these things, we will keep all of our residents, particularly our most vulnerable, safe and alive. So in the meantime, please stay as close as home as you can. Please stay safe during this time, and always please stay calm. Thank you.
You've been watching today's update on the COVID-19 pandemic from Erie County Executive Kathy Dahlkemper. Real quick recap now. This has been going on for more than an hour, so I'll keep this brief. 12 new cases reported today. The breakdown demographically, at least by gender, goes 58% female, 40% male, or 42% male in Erie County. A large portion of this afternoon's discussion seemed to center on what's happening with the long-term care facilities. In fact, one of the guests on today's briefing was Dr. James Lynn from the LECOM Institute for Successful Aging, and they're kind of coordinating the response and the helping hand, if you will, for long-term care facilities in Erie County. They specifically referenced some situations at both Twin Brook and reported situation at Cory Manor. And Kathy Dahlkemper at one point said, basically as a reminder to everyone, that the outbreaks at these long-term care facilities were being brought in by workers who obviously leave work, go to the outside, and are exposed to other people who have contracted COVID-19. And with that in mind, Kathy Dahlkemper emphasized that it was important for all of us to not become complacent, to do our part. So let's take a look at the numbers now. As of this afternoon, the latest confirmed cases near us, Erie County reporting 12 new cases. Total number now 1,037, 206 active cases, and now up one. That should be 26 total deaths for Erie County. Across the Commonwealth, the State Health Department reports 705 additional cases. Statewide total now almost 116,000, with 12 new deaths reported for a total of 7,244. Around the region, Crawford County reports 136 cases. Warren County reports 20 cases. Chautauqua County, New York, now at 244. Ashtabula County at 544. As always, the best advice, we've been saying it for months, it's still true. Stay calm, stay home, wash your hands often, and social distance at least 6 feet apart from people, especially people that you don't live with, and wear a mask. We'll, of course, have a complete wrap-up tonight on Jet 24, beginning at 5 p.m. I want to thank you for joining us. Good afternoon.
This has been a Jet 24 Fox 66 special report. For ongoing developments, log on to yourerie.com. We now return you to your regularly scheduled programming.